Hi friends, today our lesson is varicose veins. Varicose veins are swollen and twisted veins we can see just under our skin, mainly in lower extremities. Varicose veins mainly three types: primary varicose vein, secondary varicose vein, spider veins. Other than the above types, we can see special forms of varicose vein in other parts of our body. Example, hemorrhoids. Veins have one-way valves that keep blood flowing towards your heart. If these valves are weakened and damaged, blood can back up and pool in your veins. This is a diagram showing the connection between superficial veins and deep veins. Primary varicose veins are dilation and elongation of superficial veins, especially of saphenous vein. Secondary varicose veins are chronic venous obstruction in the deep veins. Spider veins means dilated superficial arterioles, venules and capillaries. Now let's move on to the pathophysiology. In normal healthy veins, valves are one-way directed and blood flows towards the heart against the pressure gradient. Superficial veins are situated in supraphysia, while deep veins situated within muscle fascia. Perforating veins passes blood from superficial veins to deep veins. Within muscle compartment, muscular contraction compress deep veins, causing blood pumping action and increasement in venous pressure. Deep veins can withstand this pressure as it's surrounded by fascia that prevents them becoming more distended. When compared to deep veins, pressure in superficial veins is very low, but exposure to high pressure repeatedly makes superficial veins dilated and tortuous. Though veins get dilated, their valves do not. So, valve incompetence occurs as a result, causing venous insufficiency. When series of valves have failed, the affected veins are no longer capable of directing blood upwards. Instead, venous blood flows in direction of the pressure gradient downwards. Over time, affected part of the body get congested and appearance of twisted, tortuous and dilated veins can be seen. Etiology. First one is hereditary. In most people, varicose veins occur due to the high venous pressure in superficial veins. But in some people, they have weakness in vein wall inborn. These people can have varicose vein even in the absence of elevated venous pressure. And second one, prolonged standing leads to increased hydrostatic pressure that can cause chronic venous distension and then valvular incompetence. Third etiology, pregnancy. In pregnancy period, hormonal effect cause increased detensibility of vein valve and soften the valve leaflets. In late pregnancy, the enlarged uterus compress the inferior vena cava, leading to secondary distension of veins. This varicose in pregnancy may or may not regress after delivery. Fourth one, age. With increase of age, veins become atrophy and more weaken, allowing to dilate easily. Now, here is the clinical manifestations. Pain and tenderness, leg heaviness, exercise intolerance, pruritus, burning sensation, night cramps, edema, and paracentesis. Investigations. Duplex ultrasonography is the standard imaging modality for diagnosis of varicose veins. MRI, contrast venography, maximum venous outflow, which can detect venous obstruction, venous refilling time, which can detect severity of venous reflux. Now, management. Avoid activities that allow venous stasis. Surgical procedures, sclerotherapy. The affected vein sclerosed by injecting sclerosing agent and compression bandage is applied without interruptions for 2 to 6 weeks. Ligation and stripping of saphenous vein. Ambulatory phlebectomy. Veins removed through tiny incisions. Laser treatment. Veins get ablated by a catheter inserted through groin. Now, here complications. Hemorrhage can occur due to the weakness in the vein. Second one, discoloration. Third complication is skin ulcers. So, thank you guys. Please subscribe my channel.